A major shortage of primary care physicians exists in Arizona.
The Health Resources and Services Administration estimates the state is in need of 563 professionals in this area.
Jodi Guerrero puts the numbers in perspective and tells us what medical authorities are doing to fix the problem.
These students are studying to become physicians at the University of Arizona College of Medicine in Phoenix. According to the Association of American Medical Colleges, the amount of physicians in the U.S. declines as the demand goes up. They predict losing about 122,000 physicians by 2032. The U.S. Census Bureau reports the nation's population will grow by over 10% by the same time. And in the next 10 years, 1/3 of all active doctors will be over the age of 65. Jennifer Acevedo Pastrana attends College America to become an X-ray technician. She says she wants to help as many people as she can. She's recently noticed the decline of students at her school.
A lot just come in, check it out, but they don't stay long enough because they think it's too long, it's too much.
Dean Guy Reed of the University of Arizona College of Medicine says Arizona produces 200 new doctors each year. They just got clearance to increase their class size to 100, and they want to continue to increase this number. Reed says the solution begins with physician residents.
Not only training new doctors, but finding new ways to train them as residents and keep them in Arizona has to be our focus.
The AAMC says if physician's assistants or nurses had a bigger role, it would only reduce the shortage by about 1%. Medicare stopped increasing the number of resident slots they would support in 1997 as part of the Balance of Budget Act. According to Reed, longer waiting times, reduced access, and possibly cost increases will result from this shortage. He also says the shortage is already noticeable to some, although even those with more resources will see it in the next 10 years if something isn't done. Kim Watson has been forced to change doctors many times, and the shortage brings her anxiety of more emerging issues.
Having to wait a long time to see a doctor, honestly, all my friends and I are starting to get older. We have never needed doctors like this before, and it's a challenge.
In Arizona, rural areas feel it the most, but there are still urban areas that do too. In Phoenix, Jodi Guerrero, Cronkite News.
Arizona will need nearly 2,000 primary care physicians by the year 2030.
Yeah, that's an increase of 50% compared to the state's current workforce.